Howdy, my name is Juan Morales. I will be presenting a case study of a closed tibial plateau fracture. My patient's initials are AG. Patient's age is 27 years old. The sex of my patient is female. The diagnosis or condition that my patient has been prescribed is a closed fracture of the left tibial plateau. Some equipment that might be needed for this condition include a knee brace and crutches. My patient did need both of those for an extended period of time. I wouldn't say the whole healing process. This diagnosis requires routine healing through subsequent encounters. Symptoms. Symptoms recorded from patient includes decreased extension of left knee, as you can see in the top right image. The knee could not extend the leg forward. Decreased flexion of the left knee as well. As you can see in the bottom right image, the knee cannot flex the leg backwards. Treatment therapy. Treatments included quadriceps and hamstring strengthening. Some examples of those exercises include straight leg raises, as you can see in the top left, where the knee extends into the air and laying on your back, as well as hamstring / flexion in the top right image, where the knee is kicked back while laying on the stomach. Quad sets / extensions, where the quads are tightened and the knee is moved. And hip extensions, where the leg is kicked backwards as a whole for hip extensions. Frequency of first 6 weeks visits are set at 2 to 3 times a week, while after that, end of treatment consists of plyometrics, sprints, lateral movements, and muscle strengthening. Some examples of these are squats, hip thrusts, jumping on a small trampoline, jogging, and heel taps. Prognosis. How are they doing? At the end of 6 weeks, flexion and extension improved. Left knee is at 1 degree hyperextension, while control knee is at 3 degrees hyperextension. As you can see in the top right image, the knee is being measured in its kicked out position, while left injured knee flexion is at 136 degrees, and control right knee is at 140 degrees. As you can see in the bottom right image, this is how they would measure the flexion of the knee. Both measurements are use the tool gynometer tool in order to measure both of these measurements. How might physical therapy help them as a patient? Physical therapy will help patient AG in ensuring movements are done as accurately as possible to ensure proper muscle engagement. As you can see in the bottom right image, the patient in this image could be using improper muscles in order to stabilize herself. The physical therapist would then step in and ensure that she's tightening her core in order to stabilize in the proper ways that the exercise would have her do so. Physical therapy can also provide demonstrations and correct form to ensure proper anatomical pathing, as well as alternatives if forms provides difficulties. Now on the right, this can be displayed through the physical therapist providing an alternative position if the position she is currently performing is too difficult. He can also provide forms that are maybe easier if the form isn't challenging is too easy or it's too hard. So vice versa, both directions can be achieved. Thank you for your time.